Hi, good morning. My name is Rob Sewell, and I would like to welcome you to today's webinar, Policy Options to Promote a Culture of Health in New Jersey. Before we begin, I'd like to take a minute to review some important information about, essentially just review some housekeeping topics for today's webinar. Just so that you're aware, if you need to reach me for any reasons, if you have any technical issues or later on in the presentation, if you have any questions for our presenters, all you need to do is use the chat box, which is in the lower left-hand corner of the screen. A couple other options that may be available to you, depending on your browser, is there are two icons in the upper right-hand corner. The icon on the left will maximize your presentation so that it will fit the width and height of your screen. The icon on the right allows you to exit the webinar. And when we are getting a couple questions about if there's ways to silence the beeps that you're hearing, unfortunately, we cannot do that. This platform does not provide that type of feature. Please note that this webinar is being recorded, and a direct link to the webinar materials, including audio and web content, will be available and will be forwarded to you via email. So at this point, what I'd like to do is turn things over to Margaret Kohler, who is the Senior Executive Director of the Rutgers Center for State Health Policy. Margaret? Margaret, are you there? We need you to unmute your phone.
Good morning. Can you hear me?
Yes, we can.
Okay. Good morning. This is Margaret Kohler, as Rob said, and thank you, Rob, for the introduction and for taking care of our housekeeping items. Again, I'm Margaret Kohler, the Executive Director of the Center for State Health Policy. I'm joined today by my colleagues from the Center for State Health Policy, Jolene Chow and Maureen Michael, as well as my colleagues from the Heldrich Center for Workforce Development, Kathy Crepsio and Amy Dumford, and you've just heard from Rob Sewell. You'll also hear from our colleagues from the Robert Wood Johnson Foundation, Giridhar Malya and Carrie Ann McGeary, who will be speaking shortly on this presentation. So again, thank you for joining us and taking the time. We had nearly 200 folks registered for this webinar, and we can tell from the beeps coming in that I think we're going to have broad stakeholder representation. So again, thank you for taking the time. We're going to be swift and organized with the agenda and move through. So let's begin right away. Rob, if you will, can you please advance the agenda, the slide deck, please? Again, the agenda for today, as you see, I will walk through the project overview, the goals and the objectives for our work here, tell you a little bit about why we're asking you to participate on this webinar and really soliciting your input on some important questions. Then I'll turn it over to our colleagues from the Robert Wood Johnson Foundation, Giridhar and Carrie Ann, who will talk more about the culture of health, which is really, and providing some context again for this project and the work we're doing. Giridhar and Carrie Ann will talk about the action framework and some of the other work that again is informing the strategy for this engagement. Then I'll turn it to my colleague Maureen Michael, who will talk about the opportunities to advance the culture of health in New Jersey and summarize what we've heard thus far from an advisory committee that we have engaged for this project. And finally, at the end, we're going to seek your input and look forward to hearing your thoughts and input. And we have a short, very short 3-4 question survey that you'll see the electronic link, and we'll ask you to complete that at the end of this presentation, and we'll tell you more about that as the presentation moves on. Again, because we have so many people on the call, we will have you, as Rob said, in mute status, but we really do want to hear from you. Use the chat function to send us questions. We'll do our best at the end to address the questions in a Q&A session. We have about 15-20 minutes allotted for that. And what we don't get to, we'll summarize in an FAQ and we'll distribute as well in the next day or two, so everybody has a summary. All right, Rob, can you go to the next slide, please? So about this project, what are our goals here? The purpose of our project is to come together and think about what a fully realized culture of health would look like in New Jersey. And additionally, what policies are most likely to ensure that every New Jerseyan has a fair and just opportunity to achieve their greatest health potential, no matter who they are or where they live. So what does the culture of health look like in the state? What are key issues to be addressed? And what are the steps for getting there? Again, these are some of the key questions that the Robert Wood Johnson Foundation strives to answer in this collaborative project. That includes, again, as I said, the Center for State Health Policy and our colleagues at the Heldrich Center for Workforce Development. With input from broad stakeholders across our home state, many of whom are represented on this webinar, this project will identify a set of evidence-based, equity-promoting policies that will lead to improved health and well-being. Again, these policies will be compiled into a report. That's our deliverable. That will be our product for this project. And the report is going to be released in late 2018, and our goal is to provide public and private sector leaders with a blueprint or a roadmap, if you will, for building a culture of health here in New Jersey. That will be one of our major goals for this project to the Robert Wood Johnson Foundation. And again, just thinking about it in terms of become more familiar with, we know now, doing the kind of work that we do, that the places where we live, learn, work, and play have an even greater impact on our well-being than healthcare itself. This report will touch on many sectors of our society. So education issues, housing, transportation, and labor, just to name some. There are certainly many others. So in producing this report, we have three goals. First, we want to make a compelling case for advancing policies across multiple determinants to improve the state's health. Second, we want to assure that the report's findings and recommendations are seen by a large number of policymakers, health stakeholders, and the public. And finally, we want this to have impact. So we hope that the findings and recommendations are presented in a way to inform state policymaking. Again, this is the idea of translating ideas to practice. And finally, later on in this presentation, we're going to touch on our timeline for the remainder of the project and our communication strategy in terms of what our plans are for fall dissemination. Can you advance the slide, please, Rob? So just an overview of the project team and our roles. We thought it was important for you to have a little bit of context about how we're working together, because we do feel that this is a partnership. You'll see left to right, we have the Robert Wood Johnson Foundation marshaling the resources at Rutgers with the Center for State Health Policy and the Health for Workforce Development. I've alluded to that we've constituted and convened an advisory committee. And then we have stakeholders, and including all of you who are participating today. I would say, and sort of summarize from this, that this project builds on a long-standing relationship between Rutgers and the Robert Wood Johnson Foundation, as we've come together previously to address many critical research and policy questions over the years. But what's unique about this project, we think, is that we're enhancing this partnership with the addition of an expert advisory committee. And importantly for this conversation, nearly, as I say, I think there were nearly 200 stakeholders who were registered, and those voices are really important. You'll see that the Robert Wood Johnson Foundation, in the brief description that we have on that slide, has a long history of investing in health in the home state of New Jersey. Obviously, I think everybody on this call has understood the underpinnings and the advancing a notion of a culture of health, and we've been fortunate enough to rely and be guided by some of their communication expertise, which will be very important as we move forward in the fall with our dissemination strategy. Between the Center for State Health Policy and our colleagues at Heldrich, we feel we bring to the table of, policy and research expertise, hopefully the ability to convene folks in a neutral capacity, and then to synthesize all the ideas that we collect through this process. Our advisory committee, we've met with them, convened them in early March. They bring a wide range of expertise and key drivers of a culture of health, and they're helping us narrow the issues that are identified through this process. And importantly, and perhaps most importantly for this conversation, the stakeholder perspective. We want it to be meaningful, and we want to bring diverse views to the table, representing regional interests around the state. We know there are distinct regional challenges and priorities, and we'd love to hear from you about what those priorities and how they should be addressed. And this is about sharing critical lessons and boots on the ground experience from the field. Rob, can you move forward the slide, please? Here, just quickly, you'll see this is our project advisory committee. I believe one of our advisors may be on this call. Again, probably very familiar names to most people on the call here, the webinar. They understand New Jersey, and they represent broad interests, including transportation, housing. They're experts in maternal and child health. And again, we have convened the group once, and we'll be reaching out to them again, including in the next couple of weeks, to review the input that we collect on this call today, both through the questions and the survey that I alluded to. Rob, next slide, please. Finally, before I turn it over to my colleagues at the Robert Wood Johnson Foundation, this is just a graphic that was shared in a recent message from Dr. Rich Besser, the new president of the Robert Wood Johnson Foundation, reasonably new, I guess, in the last year. And again, it really just it highlights all the factors that influenced health and well-being, and we've discussed them. I've mentioned them in my previous slides. And I would ask, as you're looking at this graphic, and certainly as you turn and listen to Giridhar and Carrie Ann talk about the Foundation's work, that you start to think about your top issues and recommendations and how they may fit into those domains. If you have other suggestions and ideas that may fall out of these topic areas, we certainly welcome hearing them, either again through chat or through when we ask you to complete the survey. So I think that's it on my overview. Giridhar, I'm going to turn it over to you, Giridhar Malya, who will tell us more about the Culture of Health strategy and how it frames this project.
Giridhar, are you there? You will need to unmute your line.
Can you hear us now?
Yes, we can.
Okay, great. We'll give it another shot here. Hi, this is Giridhar Malya, Senior Policy Officer at the Robert Wood Johnson Foundation, and I'm here with my colleague.
Hi, I'm Carrie Ann McGeary. I'm a Senior Program Officer in the Research Evaluation and Learning Unit at the Foundation, and thank you all for joining us this morning.
Yeah, this is Giridhar again. It's our pleasure to be on this call and to be partnering with the Center for State Health Policy and the Heldrich Center at Rutgers on this very important project. Next slide, please. As you all know, the Robert Wood Johnson Foundation is working with partners all across the country to build a culture of health. As Margaret said, it's a society in which everyone, no matter who they are or where they live, has a fair and just opportunity to be as healthy as possible. This requires action in 4 key areas, which I'll describe in a minute, but I want to start with equity. That's really at the core of what we do. Achieving equity requires that we remove obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to jobs with fair pay, quality education and housing, safe environments, and health care. Next slide, please. And what you'll see is that equity is different than equality. When it comes to expanding opportunities for health, thinking the same approach will work universally is like expecting everyone to be able to ride the same bike. There are three essential features to achieving health equity that we want to underscore. The first is one I already alluded to. It is that it requires addressing the underlying social inequities in opportunities and resources needed to be healthy. And many of these inequities have been in place for a long time and have actually been created through policy. The second is that we must systematically target our efforts to produce the greatest health benefit for disadvantaged groups, those who are worse off both on health and on opportunities to be healthy. What's important about this is that these efforts will benefit those disadvantaged groups, but they'll also benefit everybody. What we know is that when each person lives out his or her full health potential, communities and society as a whole thrive. The third key piece to achieving health equity is that when we measure progress, we can't just look at the average impact on the health of a whole population, but we must look at changes in the selected outcomes among disadvantaged groups and whether the size of the gaps between the disadvantaged and the advantaged are growing or whether they're closing. And if you want more information about health equity, you can visit rwjf.org/equity. Next slide, please. Here you will see our action framework, so what it takes for building a culture of health. And you'll notice that equity is really the context in which all these actions must be taken. The first action area is making health a shared value. This gets at the idea that we're all in this together, and that when everyone treats health as a priority, whether it's in public policy making or personal decision making, we'll see a comprehensive cultural shift in our country. Second action area is fostering cross-sector collaboration to improve well-being. This gets at the idea that building a culture of health is a team effort. It means that sectors typically seen as outside of health and healthcare, such as education, business, and community development, are joining forces to build a culture of health. Third action area is creating healthier, more equitable communities. This means that the places where we live, learn, work, and play all contribute to our ability to become and stay healthy. And it gets at the idea that health is really a local phenomenon. Lastly is strengthening integration of health services and systems. When healthcare is one part of a larger network of services that includes public health and social services, we can better address the realities of patients' lives, improving health outcomes, driving down costs, enabling people to embrace preventive care, and empowering providers with the connections needed to help people live healthier lives. So I'm going to turn it over to Carrie Ann to take us through the next set of slides.
Thanks, Giridhar. So New Jersey is our home state, and it's very important to us. And as Giridhar said, health is local. In addition, to build a culture of health, we see states as a critical part given our current policy and political climate. As a result, actually, could you forward one slide, please? Thank you. And according to America's Health Rankings, New Jersey ranks 12th, up from 21st in 1990 in America's Health Rankings. We've noticed that 800,000 New Jerseyans gained coverage through the Affordable Care Act, including 550,000 via Medicaid expansion. And New Jersey has seen a steady increase in pre-K participation since 2002, from 20% of all 4-year-olds to 29% in 2016. And we also know that there's wide disparity in New Jersey. Within counties and across the state, we see symptoms of inequity and wide disparity in health outcomes. Everything from smoking rates to infant mortality, physical activity, public health funding, and education status. Next slide, please. And at RWJF, we place a strong value on the importance of policy. Policy is critical to building a culture of health. It affects entire jurisdictions. It's long-lasting with good implementation and enforcement. It helps to change norms and expectations of health, and it can address structural barriers to equity. If you take the example that's on the slide.
So in the interest of time, I'll be a little briefer than I had imagined I would be at the beginning, but just to let you all know the importance of policy. Policy is critical to building a culture of health. We see it as affecting entire jurisdictions. It's long-lasting with good implementation and enforcement, and it helps to change norms and expectations of health. It also can address structural barriers to equity. And what I've offered to you all is a graph of really how the evolution of tobacco control policy was able to impact smoking rates and smoking-related morbidity and mortality. So next slide, please. Now, one of the things that we should all be aware of, if we could get to the next slide for importance of evidence.
Yeah, it looks like ReadyTalk is having more problems, web problems. So audio apparently is working, but for some people
Okay.
It looks like the slides are advancing very slowly.
Okay, sounds okay. So I'll just move forward. And so with the importance of evidence, tobacco control policy was built on very strong evidence, and RWJF places a very high value on evidence. Evidence-based policymaking uses the best available research and information on program results to guide decisions at all stages of the policy process and in each branch of government. Evidence-based policy in New Jersey has been used to reduce spending, and by using evidence on program outcomes to inform budget choices, policymakers can really understand how programs are working and free up dollars for other uses, including expanding innovative programs. So with that, I'll turn it over to Maureen Michael, and she'll talk a little bit more about our project overall.
Thanks so much, Carrie Ann. So I wanted to talk to you a little bit about the criteria that our project team, next slide, thanks. Thanks so much. I wanted to talk to you about the criteria that our project team has discussed in building the options that will be part of the final report that we're all working toward. The first is, will it address New Jersey's most pressing issues? The second, is it necessary to promote a culture of health or population health and well-being? Third, are there equity promoting and evidence-based solutions for the problem? And then lastly, is there a path toward implementation of these solutions in New Jersey? And meaning, is it politically and within the budget constraints feasible for New Jersey? That's what we'd like you to think about later on as we ask for your thoughts on the most pressing issues and solutions for them. Can I have the next slide, please? Sorry, the one for the advisory committee.
Go back.
Back one or two.
Can you go back, Rob? One more.
Okay, I'll just talk briefly about what we've heard from our advisory committee, who we convened earlier in March. And I'm not going to get into very specifics of the ideas they came up with, but overall themes that emerged from the meeting. First, they had recommendations that really went around the clock of the factors related to a culture of health, really spanned many key drivers of health and well-being. And they talked about equity and discrimination and the importance of both of those in improving health and well-being. There was an emphasis on really cross-agency and cross-sector collaboration and how we can infuse health in all decision-making across and outside of state government. and just about the opportunity now with the new administration really providing a ripe environment for thinking about broad policy changes. But lastly, kind of thinking about those changes in the context of the current political and budget environment. So, next slide, please. Thanks. And then the reason why really we brought you all together today, we want to capture your most important ideas for how to move forward toward a culture of health in New Jersey. What are the most critical issues and problems that we should be addressing? And we've developed a little survey, the link of which is, the link to the survey is on this slide. And we're asking you first to think about the top 3 problems that the state is facing in moving toward improved health and well-being. And we've arrayed a number of factors, and there's also a blank for you to fill in your own factor to the extent that you don't believe any of those are among your top 3, or to the extent your issue is not included in those. And then after that, we're asking for your ideas, again, keeping in mind evidence-based solutions and equity promoting of what would move us toward realizing this vision. So again, the question of what is the vision and how do we start getting there? Lastly, we are capturing some demographic information about your organization. And then also, we'd like to hear if you'd like to continue to be part of the conversation as we move forward and really dig deeper into the priority issues and how to address them. And so we're looking for, the survey link is now on the screen, and we're also looking to hear any questions you have before you fill out the survey. And to the extent that we're not able to answer them in the time that we've got, since we've had some technical glitches, we're also happy to put up a frequently asked questions page for everybody to share. We're going to look through any questions that we get, and then I'm going to turn it over to Kathy to talk about the next steps.
Great, thanks, Maureen. Next slide, Rob. So I'm Kathy Crepsio, and I'm the Executive Director of the Heldrich Center, and I'm going to have the briefest presentation, which is the one-slide presentation. As you can see from the slide, we're on a very accelerated time frame, and what our next steps really are is getting input from the public, as Maureen and Robert Wood Johnson and Margaret have said, that you are a very key and meaningful part of this process. We're going to be narrowing the list based on today's input and input from our advisory committee. We're going to have future conversations with a subset of stakeholders, and as Maureen said, please, please, please fill out the survey. And part of that survey is going to ask you if you want to participate in a smaller subset of stakeholders to help us synthesize further the input we're getting. And then we're going to spend the fall disseminating our findings to inform policy discussions. And as Margaret had alluded to earlier, we will be finalizing our project with a blueprint or a roadmap from New Jersey that we will share very widely with some public and private leaders and the public at large. So at this point, what I would like to do is advance the next slide, Rob, and see if anybody has any questions that we can answer before we conclude today's webinar.
Thanks, Kathy. So just a reminder, if you do have some questions that you would like to submit to our presenters, just use the chat box, which is in the lower right, the lower left-hand portion of your screen, and then you'll be able to submit your questions, and I'll relay them to our presenters. And we have had a few questions that have come in. So the first one is for Garadar and Carrie Ann. We have, the question is, what levels of evidence are required to qualify as an evidence-based policy recommendation?
So I'll take that question. Thank you. So that's a very important question, and we don't actually have clear recommendations on what the level of evidence needs to be. What we are focused on at RWJF is that the evidence level depends on the context in which the question is asked and the question being asked. So it depends on what you really want to understand. For instance, for benefit cost analysis, the level of evidence would be different than understanding the context of a problem. But either way, we would like evidence to be present in our discussions.
Yeah, this is Gary. The only thing I'd add to that is that as much as possible, we'll try to draw from sources of evidence that folks around the country use to make policy and practice decisions. So things like the Community Guide to Preventive Services that is maintained by the Centers for Disease Control and Prevention. And we'll also rely on resources that we ourselves at RWJF have helped to build, like the What Works for Health database that's part of the County Health Rankings and Roadmaps program that we do jointly with the University of Wisconsin.
Excellent. Another question we have is, to what extent does this project integrate behavioral health with physical mental health? For instance, people managing illness and or the disease of addiction touch all of these factors in the wheel.
Yeah, this is Gary there. That's a great question. And if you think back to the action framework and the fourth action area, it's about integrating systems and services. So what I didn't specifically call out was within the healthcare system, the medical system, what we really need to do more and more of is integrate physical health and behavioral health. That came up in the conversation with the advisory committee, and our sense is that it's going to come up as we continue to have these stakeholder discussions. I think more and more we're finding that there is good evidence to support providing people physical health and behavioral health services at the same time and in the same place. So we really welcome that question and look forward to ideas and recommendations that come from folks on this call, but also the people that we engage over the course of the next 1 to 2 months.
Excellent. Just a reminder, if you have any questions, please use the chat box to forward them to me, and then I'll relay them to our presenters. We do have a couple others. First one is, while tobacco has success with policy change, it seems it may be a little different than providing access to healthy foods and increasing physical activity, since the priorities take many changes and many are economically based. How can we work with policy when there are many layers of equity?
This is Gary there. I can start on that. I think the first important thing to mention is that policy in and of itself probably isn't going to get us to where we need to be to build a culture of health. We're going to need policy change. We're going to need effective and targeted programs. We're going to need practices that are based on evidence. So there are multiple types of interventions that we'll need to build a culture of health, and that's the case for building health in any community. The reason we called out policy was for the reasons Carrie Ann described. We feel like without policy, we're not going to get the type of systematic change that we need. You're right that with tobacco control, it probably is a health and well-being issue where the policy strategies are clearest. Unlike maybe the challenges that we face right now with promoting better nutrition and physical activity. One thing I'll point out is that when the tobacco control movement started about 25 or 30 years ago, a lot of the policies that we know are effective now and almost take for granted, we didn't really understand well whether they were based on the best evidence or whether they would have the impacts that we need. So I think through this process, what we also want to do is, as strategies are deployed, whether it's in New Jersey or across the country, that we're carefully evaluating whether they're having the intended effects, whether they're having unintended effects, and whether there are ways to modify or change the policy over time to make it even more effective.
And the only thing I'll add is that policy is important for us in the equity conversation because we have a lot of structural policies and regulations and things that need to be addressed to reduce the structural barriers to health and well-being. And so without the policy and the evidence on the policies and how they can really address these structural barriers, we'll be missing a key tactic in the overall strategy. But you're right, there are many layers of equity, and narrative change is another thing that we really need to address as well, and we recognize that as an organization.
Are there areas already of interest for Robert Wood Johnson Foundation in New Jersey based on prior work or research in the state?
Well, I think one good place to start is the priority areas for the foundation, and those hold for New Jersey, but also for the work that we do across the country. Those are promoting healthy and equitable communities, giving every child the opportunity to have healthy physical, social, emotional, and cognitive development, and then also strengthening healthcare, public health, and social services, and creating greater integration. You'll see that there are a lot of similarities between our priorities and what's mentioned in the action framework. And I think our history of partnering in New Jersey has been in those three areas and will continue to want to grow. Maybe another thing that Carrie Ann might want to comment on is how we're trying to learn from best practices in New Jersey to influence what people are doing in other states.
Exactly. It's definitely a two-way street. In this call and webinar today, we're really hoping you can tell us what you think are the priority areas for New Jersey. While we, obviously have our nationwide focus and our ideas of policy for the nation, certainly those things could be applicable in New Jersey, but we also want to hear from you about what you know about New Jersey, the best evidence, the best practices, and the best policies that really have helped advance New Jersey.
Yeah, I'll just include one last thing. We gave a quick example in one of the slides that New Jersey is one of only 4 states with an active paid family leave law. We think that's a really good example of how New Jersey can be seen as a leader in this policy domain. So paid family leave laws have benefits for families in terms of being able to take time off while still maintaining some portion of their income. But we also know that it has health benefits. It improves mental health among parents, particularly moms. It can increase immunization rates. So this is a case where New Jersey is setting an example for other states. And I think we'll want to hear about other examples of where you think New Jersey is leading.
We definitely see New Jersey as a state of first.
Great. We have another question. Will there be an action component to these policy recommendations? What efforts will be made to get people to implement these recommendations?
Yeah, that's a great question. This is Gary there. I think our primary goal is to engage all the right folks that we can in developing the recommendations. So once they're finally made, people feel like they had a voice in identifying what the priorities were and what strategies are most important. We feel like getting a diversity of opinion and getting that engagement and buy-in on the front end is going to be really important in terms of taking action. So that's one. Two, as part of this process, we're thinking through ways to engage with state policymakers. We think that they are a really important stakeholder group, both in terms of informing priorities and strategies, but they're also the ones that in many cases may need to take the actual policy actions to see these recommendations come to fruition. I think the third is that once the report is complete, we are developing a plan to do pretty broad dissemination so that policymakers, leaders from across the state understand what the recommendations are, what it will take to put them into practice, and then importantly, what their role is in making sure that the recommendations do actually turn into action.
Again, if you have any questions, please use the chat feature to send them to us. At this point, we don't have any additional ones. Maybe give it like another minute, actually, because I see a couple people are typing some questions right now. So just 1 second, folks.
So Rob, if there is one more question, maybe we can take it, but otherwise we can probably wrap up.
Yeah, like I said, I saw a couple people are writing some questions, but they haven't arrived yet. So if you want to, I'd suggest wrapping up then.
Yeah.
Nothing else has arrived at this point.
Yeah, I think we can be sure to leave people with contact information so that they can submit additional questions. And we'll also be following up with all the participants with a summary of what we discussed today and our next steps.